And yes, and I have done rescue. That's part of it. Yes, and I was also trained.
All right, good afternoon, everybody. We're going to go ahead and get started with today's meeting.
Okay, we will call the meeting to order. At this time, we will begin with item number three up on our agenda, public comment. Any citizens who desire to address the board with regard to matters on the agenda will be received at this time. Were there any written comments submitted? No. Is anyone signed up to provide verbal comments? At this time, we will close the public comment and move to item number 4, orientation. Item A, review and discussion on Animal Advisory Board roles and responsibilities. Nicole Salas, Assistant Director of Environmental and Neighborhood Services.
Good afternoon, everybody. So my portion will be a bit bland. It's just general housekeeping things, right? So this is our required annual orientation for y'all. So we'll be going over board membership, roles and responsibilities, the Texas Open Meetings Act, the Public Information Act, our general meeting schedule, attendance requirements, and then required ethics training. So the advisory board was created with appointments made according to membership requirements and qualifications as provided by state law. So it is since we operate a shelter, it is required by state law that we have an advisory board. They are appointed by city council. We did expand from 5 to 11 in 2017, and there are certain requirements of what the board must consist of. So we must have a licensed veterinarian, an animal welfare organization representative, an animal services volunteer, someone responsible for the daily operations at the shelter, which is Dawn, and then a municipal official, which is Dawn Steph, our director. So we, again, we expanded that board. We wanted volunteers, anyone who had adopted an animal from the shelter, someone who is just generally interested in the welfare of animals, someone involved in local community organizations, with a career in an animal-related industry, medical, epidemiological, zoonotic fields, a career or experience in wildlife management, or you work for another shelter or rescue group. So just a wide range of opportunities and interests with our board membership. So what do you do? The board is responsible for reviewing and recommending procedures for the care and maintenance of the animal shelter facilities and the animals to ensure compliance with state law. You periodically review animal control ordinances. You review our animal control policies, programs, and practices, and you all give us feedback on what you think is the appropriate direction for the shelter. You review animal capacity calculations and animal population trends. You review and recommend policies and programs for new items at the shelter. You determine our needs versus our wants. If y'all recall, we did have an exercise regarding needs and wants in regards to the new expanded animal shelter. You recommend funding options for programming of space, and we still need to pick back up on that discussion regarding the capital campaign. So we ask for, again, as I mentioned, we ask for specific feedback. We want to know what your opinion is regarding program operations, animal services ordinance, standard operating procedures, our SOPs, our monthly Patopia reports. We have had extensive discussion regarding those before. education and outreach, the animal shelter expansion, and the capital campaign. Okay, Texas Open Meetings Act. This is a public meeting, okay? The city and the Animal Advisory Board must comply with the Texas Open Meetings Act. Punishment of up to $500 fine, which is a Class C misdemeanor. Our agendas are posted for the public to review. And the meetings are held in an area that is open to the public, so that if they so chose, they could come in and listen. And as we did at the beginning of the meeting, provide feedback regarding items on the agenda. So all of your discussions and your votes are made in an open session. So one thing that a lot of y'all are familiar with each other. So, make sure that you're cautious about what we call a walking quorum, which is where you'll speak amongst yourselves outside of here and kind of, just in passing, have conversations. All conversations must occur within this forum so that it's done in accordance with the Open Meetings Act. We do have public comment at the beginning of the meeting. Any citizens that are wanting to address the board must complete the request to speak form. We always have those here at those meetings. So if anyone were to come in, they would need to fill out one of those forms. Rob is holding them up. They would need to fill out one of those forms so that they would have an opportunity to speak. And they are limited to 3 minutes. And any speaker that requires a translator has 6 minutes. So comments and discussions by the board will only be made at the time that the subject is scheduled for consideration on the agenda. So it's important for y'all to take a look at the agenda before our meeting. That is what we will be discussing, and discussions are limited to that because those agendas are posted to the public to make them aware of the upcoming discussion. So that's why we limit the discussion to just what is on the agenda. So as a city, we are required to comply with the Public Information Act. This gives the public the right to request information from us. They must be made to the city in writing. And we have a time frame for which we are required to comply. Any exceptions to information being released, we have to consult with the Office of the Attorney General in order to get approval to redact or exclude certain information. Okay, so our meetings, we will have those typically on the second Wednesday of the month. Obviously, this time we had to shift it around a little bit because of other events that were going on in this room. But just in general, we have them on the second Wednesday of the month here in this room at Public Works. And we may hold them virtually. That's just dependent on Governor Abbott and whether or not he allows us to hold meetings virtually. Okay. And we must meet at least 3 times a year, but we have a busy schedule coming up, so we will definitely exceed those 3 meetings a year. As board members, you are expected to attend most meetings. We want to make sure we cover a lot of information during each individual meeting, so we want to make sure everyone is up to date on what is going on and aware of what's going on. So we ask that y'all attend most meetings. If you're no longer in a capacity to attend meetings, please let us know, and that way we can fill that vacancy with someone who is able to attend on a regular basis. Anyone who misses 3 consecutive meetings is assumed to automatically have submitted their resignation. Okay. And there is mandatory ethics training for all of you, but that was previously done with our city attorney. So everyone here has already undergone that, gone through that mandatory ethics training. Any questions? Questions?
Okay, now we will move on to item number 5, workshop. Item B, review of and discussion on animal shelter update by Mr. Don Specs, Animal Services Manager.
Okay. So an update on our current shelter population. Right now, we currently have 58 dogs and 45 cats. So a nice reduction in our cat population there. Procedural changes to contain disease outbreak. We had a few outbreaks of diseases that we needed to address. So we set about some specific things to mitigate that situation. One, we isolated our sick animals to staff only, and those areas to staff only to make sure that there was no cross-contamination from our sick animals to our healthy animals, which were available for adoption. We moved to look at those places where the spread of disease was occurring. So we also went to disposable food bowls to decrease the amount of things that are going into the water and being cleaned together, and also separate the cleaning areas as well, to separate the soiled litter boxes, the soiled towels, and all of those things from where the dishes and the things are being washed as well, to kind of have a clean break in the disease process. Also, we implemented some rigorous sanitation protocols that are recommended through shelter medicine, using rescue, which is accelerated hydrogen peroxide. It is the best recommended thing for most diseases of living species. So we implemented a program to use the majority of that in all of our cleaning for both our cats as well as our dogs as well. We increased our contact time for cleaning in these areas, especially those where the animals are isolated, and implemented periodic deep cleaning for those areas as well. And what that deep cleaning means is once a kennel has been is no longer in use, we take the entire thing outside and we clean it multiple times, both with a bleach solution as well as our rescue solution as well, the accelerated hydrogen peroxide. Then we allow it to dry in the sun where the UV lights also assist in the destruction of the pathogens. Foster program. I am proud to say we have begun to build a robust foster program with the development of the website and some documents you have in front of you. The Foster Handbook. It is a exhilarating read along with the application. We wanted to build something that opened it up to the public and anyone who was interested in caring for animals, people who had experience with fostering or experience with bottle babies or experience with anything that they wanted to do to get our animals out of the shelter and to get them healthy. So we created this foster handbook and also the application, which goes over behavior questions about the environment we'll be sending the fosters to as well, and just a little bit of general information. We wanted to make it easy for people to be able to assist us and find a way to say, yes, please come in, please help, and take away a lot of the roadblocks that we need to do. Along with that, we also launched on our website, sugarlandtx.gov, in the animal services area, a foster program link. So people can click on that link and they can go to that portion to download these documents on foster programs. And we'll also be updating that information as well to drive traffic to that particular part of the website so that we can start engaging people more with the foster program. Shelter hours. I'm really excited about this as well. Our shelter hours have changed. We are closed on Mondays to the public for adoptions, but we are still open for business as usual. That includes our animal service officers are still going on calls. We are still receiving any lost or stray animals, but we're closed for adoptions to the public. Tuesday through Thursday, we're open from 8 to 5 as normal. I'm sorry, Tuesday through Friday. Tuesday through Friday, we're open 8 to 5. And Saturday, we are now open 10 to 2 for adoptions and sleepovers. And we had some adoptions this weekend as a result of that as well. So that's good news. Expanding our work with rescues, we began to renew our relationships here locally with a lot of the rescue partners and looking into other rescue partners that we haven't looked at before and reaching out to them for assistance in transporting our animals and finding positive outcomes for a lot of our animals to assist with the preparation for the temporary closure of Whiskerville for repairs. And preparing for that, we worked with RPM, Rescue Pets Movement, Operation Kindness, Houston SPCA, and many others in order to transfer a large number of our healthy cats to organizations that were in need of adoptable cats and had the capacity to move them very quickly to different avenues and to find positive outcomes for them. So we were able to do that. So we are prepared for the beginnings of our restoration of that building. I believe that is all. That's some of our rescue partners here. Also to mention Mile High Labrador Retriever Rescue and Pup Squad Animal Rescue. We had a few mama dogs come in and they were ready to bless us with new life. And as you can see, they had their babies here in the shelter. And we immediately reached out because it's better for them to be raised in a home away from the stress and the disease and things like that. And we immediately found people who were willing to assist us with that. RPM, Rescue Pets Movement, they're excited about our animals as well. And Operation Kindness, who we also reached out and took some dogs and cats as well. So we're trying to keep those relationships going so that we can all kind of work together in our local communities to assist with our animals as well. Questions?
Okay, so you said we have 58 dogs right now, and in the most recent community impact newspaper thing, it says that the shelter can reasonably house 62 dogs. Now, from being a volunteer over there, I don't know where they get that number because we have 20 kennels and 4 ISO. So reasonably, to me, doesn't mean up and down the halls and little pens or wherever we have to put them. So I don't know why they're saying we can reasonably house 62 dogs.
That's a good question. And actually, that's some things that we brought up to look at. We decided to reach out to other shelters and other leaders in shelter medicine and organizations to find out what their calculations for capacity for care are, to see where our numbers should really lie as far as the actual numbers for that. I can't give you an exact number where it came from or how we got to that point, but that is something that is at the top of my to-do list to look at those. But I didn't want to make the mistake of just making a guess of a number, so we're actually talking with different people and meeting with people from different cities that are like us to find out how they calculated their numbers as well.
Can you talk more about the Whiskerville, what we're doing, and are there any where are we putting our healthy intake cats that are coming?
Oh, yes, absolutely. So in Whiskerville, we do have what's considered our cat ISO area. That's a much larger room to keep the cats more separated, at least 6 to 8 feet apart from each other, and a larger airspace. And then we have an isolation room off of there for things that want to isolate from our respiratory. And then we have a hallway of cats that are intake cats as well, and some of our kittens that just don't want them around anything to make sure that they're healthy. But because they are strays and because they just got here, we don't know if they've caught something before they got here or if they already have something while they have here. So I wouldn't really consider them healthy at that point. So we usually like to keep all of those in an area. So we consider that an isolation, that whole back area, until they're considered healthy. Once they're healthy, then we do move them into the adoptable cats area. Fortunately, right now, we don't have any adoptable cats, and most of them are located at that spot right now.
So going forward, I guess what I'm asking is, what are we doing to the building in terms of maintenance? What's wrong with it, or what is getting improved? And where are there going to be any cats available? Like, I'm speaking as a cat volunteer, and so this is all brand new. I haven't heard anything about this. And so I was just wondering, am I going to be coming in to to clean? Are people gonna be able to come in and adopt cats, or where are we gonna eventually put those cats?
So Dawn is actually going to be covering that as a topic in her director's
Okay, cool.
update as
Okay.
far as building maintenance. And we'll be able to elaborate a little bit more on what exactly is going on.
Got
in that.
Okay, thanks.
Yes.
You mentioned the number of dogs. Are they predominantly a particular species? And are the partners that are the partnerships that you are developing receptive to all species or?
Yes. We work with some rescues which are breed specific because that's their bread and butter, that's their niche, and we'll send as many as they're looking for those. But most of our rescue partners will just take any animal because of where we are. There are certain species, there are certain breeds of dogs that are more prevalent, and so those are the ones that they usually want to concentrate on. But they're always open to others as well. So whenever we do look at transfer, we send them all of our available candidates. We don't discriminate. Everybody, we're going to send everybody and see as many as they're willing to take and work with them and work through them locally here to get them. You're welcome. Yes.
I have a question about the foster program, and I will read this probably, but I'm sure it might be in here. I understand it's a newer program.
Yes,
Okay, just to make sure since I'm new.
absolutely.
Is it a foster to adopt or foster long-term? The reason why I ask is when you brought up RPM, I've fostered with them for 7 years since they started. In fact, I had a dog just for 3 nights that I took yesterday to be transported to Colorado. RPM is strictly foster only. You cannot adopt from them.
Right.
And I've fostered dogs with them for 2 days or 5 months. So when I think about this foster program, those questions come to mind. Is it, can I adopt? Because, Bark and Fort Bend County, you can foster to adopt. That's one question. And then my other question is length of time. Actually, I guess I have 3 questions. Length of time. I want to foster for 2 weeks. Can I do that and bring the dog back? How does that work? And I guess my third question, and you don't have to answer them all now,
I've got answers.
this is a pretty lengthy document and the applications are pretty lengthy. And I'm guessing this questionnaire, just glancing at it, is for me, the person fostering, to fill this out on the animal that I'm fostering. So with all this, volume here to look at, and I'm a foster, through that education and outreach that I saw, is there an intent or a goal to say, okay, community, before you foster, we want to do a foster training or a foster orientation? Those
Yes.
are my questions.
Yes. Gotcha. So foster to adopt, absolutely.
Okay.
I would like it's a double-edged sword. We'd like for you to foster as many times for as often so that we can utilize that person for foster. As you know, you get one, that one goes, you get another one, that one goes, and then we encourage foster failures too.
Yep.
So that you suddenly find that you have now owned this animal because you've fallen in love, or you have found someone who is interested in that animal. And that's the thing that we'd like to encourage as well, because we're able to get them out into a home environment where we can see their actual personality, and they get to see more people. They're going to see more people in that home environment than they would in the shelter. And if someone's interested in adopting that animal, by all means, we will absolutely make that happen. As far as time, we don't have a time limit, but we would like to ask for a length of time for them, just because when they're leaving the shelter, that gives them the opportunity, if they're sick, to get over that, or if it's just to socialize or things like that. We have home for the holidays, or we want them to just have a good Christmas, maybe a happy New Year. So as far as the time limits, we're looking at that length of time and what people are willing to do, but we always kind of ask them for an extended period. And as far as training, since it's so new, I can't really answer exactly what the training is. My goal is to find those people who are interested and then have a face-to-face with them when they come to pick up their animals. And once we start to pick up the program and start to have a larger number, to have some orientations and best practices and kind of have people meet each other so they can mentor each other.
Thank you.
Yes.
I think I know the answer. This is gonna, I guess, fall under disease outbreaks. But I think we have some new policies that I would like you to get credit for, but I would like you to state exactly what it is, so I don't misquote, as far as the heartworm treatment that's being done now before adoption, where it did used to, as well as I believe that the inoculations that are being done sooner.
Yes.
Can you speak to those?
Yes, we've increased our ability to identify the animals that need their vaccines and need their updates. When you have a large number of animals, it's like having a whole classroom full of kids, and you have to keep up with every single assignment that they have and everything that they do. So we create reports so we can determine who is due for vaccines, which helps with the disease control because they're fully vaccinated, as well as deworming and the prevention, including heartworm prevention. For those animals that are heartworm positive, we treat that. So we go ahead and start that treatment process early so that we can go ahead and make them more adoptable on our end. And if they're in the middle of that process, if someone's interested before they go, then we've already started that, and we can send them to a sleepover as well. We have started to make sure that on intake, all animals are immediately vaccinated, and they are given any type of parasite prevention, as well as in testing to determine if they have any particular diseases. Anything that we do find that is concerning, we do send to the veterinarian that we have on contract for further examination. Anything else?
I mentioned,
Yes, we did. Yes, that is one big thing. That is also how we were able to begin identifying and streamlining the process for intake. Is we began to utilize our current software program more robustly. Before, everything was by paper, which means it had to pass through 3 to 4 hands as far as getting any identification of what was going on. And some of those folders would get lost, some were misidentified or not followed through with. I worked with our current software program, Chameleon, and developed reports and began training with all of my direct reports and their team to input all information, all medical information, all behavioral information, and anything in that software program so that we could track it and follow it and be able to follow up on animals that were missing their vaccines and such. It was much harder to go through over 100 folders. As those of you know, before computers, that's a lot to do. But now they can just kind of go in, run a report, and determine exactly which animals are needing their vaccines based upon our protocols and the date that they came in for their intake.
I'd be curious in general, just to see an org chart, just to kind of see like where we can fit it in help. Like I have experience like with bottle feeding, different animals, but like if you're working on an education program to implement, I'd be curious to see if I could help out with that. And I think there's a lot of people on here who might be very good at helping out with the educational sides of things.
I'm sorry, Joey, can you elaborate on that, please? You're asking for an org chart?
Oh,
like,
well, yeah, I wouldn't
staff
even know,
or
yeah, I wouldn't even know
services?
who to go to, like,
Okay,
to offer my help.
just want to make sure we're getting. you
Oh,
the
yeah, but just,
information.
yeah, in general, like, it would be helpful just to kind of know who's in charge of what.
Okay.
Anything else?
Now we will move on to item number 6, Director's Report. Item A, Program Updates, Upcoming Agenda Topics, and Review Concerns by Dawn Staff, Director of Environmental and Neighborhood Services.
Good afternoon. I love seeing the familiar faces and new faces. So if you don't know me, I was the director of ENS prior to Stacy coming on board. So I am back as an interim director right now and happy to be back helping with the Animal Advisory Board. So we will get into I will start with the whisker bill repair, so perfect segue into it. I actually asked Keisha Seals to come. She's our assistant director of ENS and is over the facilities group who handles all of our buildings. And so she'll just give us a quick update on why the repairs are needed and what's going to happen and what the expectation is.
Thank you, Dawn. Hi, good afternoon. Again, Keisha Seals. I'm happy to be before you, and I'll give you a quick update on Whisker Bill. We are actually in the process of making some necessary and much needed repairs, as you all probably are aware, to the facility. And so what that's going to look like is we're temporarily doing a make ready facility that's actually on the campus now. It's in the back. And so we're doing some necessary repairs there in order to be able to move the equipment and the animals over into that facility while your facility is being remodeled. And what that's going to entail is we're going to do some drainage improvements around the facility. We're actually going to install more columns underneath the facility to give it more support. We realize that over the years, there's been a lot of drainage that has fallen underneath the facility. And that's not the way it's intended to go, right? Drainage should pitch away from any water, should pitch away from any facility. And so we're going to make that repair. Once we're done with that, we're going to go into the facility and actually rip out the flooring and put in all new flooring. So, and we'll rip it all the way down to the subgrade, stabilize the subgrade, put in a much thicker subgrade, and then put in a much sturdier floor. So when you do, unfortunately, have to, drag your cages around and or the dogs are scratching at it or something like that, that floor will be much more durable. And so the reason why you're feeling kind of like the squishiness underneath the floor, of course, is because of all the soil saturation that has taken place over the years. So we're going to get that fixed for you. You're going to have a brand new floor. It's going to look like a brand new facility because you'll be walking and you'll be on something stable. Right, so that's what we're going to do. I'm thinking the timeline is going to take a couple of months. One, because we have to do our permitting process. Of course, we're entering into the holidays, so the contractor will actually get started on the beginning of the year. And then once the contractor actually gets on site, then it'll probably take them about a month to do all the necessary repairs. Now, I am going to caveat that with, we, just like everyone else, has been seeing a tremendous amount of lead time, which means material is not available, right? And or there's been concerns with shipping. So that has impacted the city just like it has impacted everyone else. So the vendor is doing all that they can to secure materials as quickly as they can, but that really just depends on the manufacturing company. Okay, so it will not be because we're not pushing them and then they're not pushing, but it's really just going to be a matter of materials being available. Any questions? Good.
So all the animals will be out of the building, because that building's used also for the vet tech and not just the adoption animals and so it would just be totally vacant.
Exactly, yeah, so we're gonna need to get all the materials out of there, all of the equipment, all of the, everything. And the good thing, again, you won't be far away because you'll be right in the facility that we have on the campus, and we'll make it work. We'll figure it out. You guys have also been here as well when needed, so we're just gonna make it work because we know that this is a much needed project.
So where is all that going temporarily?
So if you go to the back of the campus, which is where, all the trucks are, all of our stockpiles or equipment is, there's a facility, just a small, little building that we've had over the years. It used to be our traffic management center. And so that building is available because no one is in it now since our traffic management center is right here. And so we're just doing some modifications, small modifications to it. We've already built a ramp up to it. So just making modifications to to make the animals, as comfortable as possible.
So will the public have access to that to adopt cats once, we have cats in there again?
You
or-
want to answer that?
No, so there is a large amount of traffic, very large equipment and vehicles that run back and forth back there. So the public will not have access to that. That's why Dawn has been focusing so much on trying to get as many of the healthy cats out. We will have staff that have a cart, like a go-kart sort of thing, that will be able to take supplies easily and efficiently back and forth. Weather protected, so that if we have to transport animals back and forth. Any meet and greets, we are going to focus on, we're going to really leverage our utilization of PetSmart. And then Dawn is also working diligently to try and get as many dogs transferred out so that we can have additional space in Parksburg to kind of dedicate to cats. So he's working really hard. It takes a lot of work between Dawn making those relationships and contacting folks, and then the staff having all of the documentation and photos and videos put together. So they're working really hard on that, but we will still be adopting out cats, just in more limited space. And our vet tech is going to be based out of that building. So we're going to be relocating supplies, the essentials that we need to operate, all of that will be moved over there. And other things we're going to work out where to store it short term until the building, because that building is much larger than the accessory building that we have.
Thank you so much.
Okay, so developing partnerships with out-of-state organizations. So just want to kudos to Don. He's done a great job at, as he said, reestablishing and creating new connections and partnerships to help us get animals transferred out. So that helps us keep our capacity numbers down. And again, allows us to remodel that Whiskerville, which is much, much needed. All of those agreements are reviewed by legal. So we have multiple eyes on those agreements. We are going to be piloting a trap, neuter, and release program with First Colony Mall. So we were contacted by First Colony due to their large cat population there. We had a conversation that would be a good testing site to see how trap, neuter, and release impacts it. So we're going to need to identify some volunteer partners to help us with that. We have been told by First Colony Mall that there are people that are going out and feeding the cats at night. And so we definitely want to reach out to those people to see if they want to help us with the program. But if you know anyone who is interested or willing to help us with the pilot program for trap, neuter, and release, let us know. I know Nicole and Dawn, they're going to be working on the specifics of it and talking with the mall management and getting that in place for 2022. So that will be exciting. Oh, sorry, did you?
No.
Okay. So I also want to, like every meeting we have, just review concerns that we receive from the public or volunteers. So just going to go through some of those right now. So we've had a concern was received about staff. And the exact concern was that we are rude and we do the bare minimum and don't appreciate the volunteers. And so I like to say that is not the case. I know when I returned back and walked over there, they had no idea who I even was, which was great because they're all new and I met all of them. They're all very friendly. They work hard. They love the animals. And so I definitely don't agree with that concern. And we appreciate our volunteers. I mean, we cannot do what we do without our volunteers. It is just impossible. We have that teamwork, like we continue to work on that teamwork. John's doing great things again, implementing new processes and policies, and I think we're doing a fabulous job. So that was one of the concerns we had. Concerns about the housing of the animals, specifically cats in the mobile carriers. Not an ideal situation. We had how many cats?
We had over,
Our peak time?
we had over 120.
So 120 cats we are trying to house. That is a huge task. We don't have enough space. So we were temporarily using those mobile carriers. Again, we have reinstated to get those partnerships with the animal groups to get animals transferred out. Our goal is to never get to that volume again. And that's something that we're going to be talking about in 2022 as well. And I'll get to that. But again, it was just a temporary until we could reduce that capacity level. A supply inventory. So we've gotten some concerns about either not having supplies. I think I've heard that we didn't have food on one day, but I mean, that we always have food. I know Nicole said that they've been in the process of reorganizing supplies and moving it. I think one day we did not have bleach, but they were going to the store that day to buy bleach. And so we're definitely putting in some protocols and, processes to make sure we always have supplies. But the food one, we always have food. We have had to change our food vendor for cat food specifically just to ensure that we have a supply of cat food at all times, because the supply chain, you go to the store, there's no food. So we've done our best to work and eliminate that issue. Shelter hours. So it was a concern we weren't open on Saturdays for people who work to come in, see animals, adopt. So as Nicole and Dawn stated, we are open on Saturdays. We are excited, and Dawn said we already had some adoptions from last Saturday. So we've been promoting that as well. So talking about the future and what we plan to do in 2022 with the Animal Advisory Board. So just, I know Nicole went through and read all of these. I'm not going to read them to you again. So these are all of your responsibilities, and all of the text in blue are what we're going to be visiting or revisiting for a lot of you, because we've had some of these discussions before, but talking about and reviewing this current year. And to give you an example of some of those topics that we will be talking about, so policy review. So we need to talk about and review our policies to make sure that we're maintaining the health of the shelter and the animal. We never want to get to 120 cats again. And so we need to look at what are those policies of what we do as we're reaching or exceeding capacity, including transferring out of state, like transferring locally. So just having those conversations and looking at those policies. We want to review the donations and social media on the website policy. There's some parameters in there that I think prohibit us from getting and like identifying and promoting those partnerships to then encourage more, more partnerships. So we want to look at that. Some program review, trap, neuter, and release. So we're doing that pilot. So we'll get through that pilot, have some data, talk about trap, neuter, and release. What do we want to do as a city going forward? Do we want to implement it citywide? Did it not work? Why? Kind of having that whole conversation. Another hot topic right now, if you've been watching the news, is hog trapping. Hogs everywhere from it, across the region. So having that conversation about wildlife management and trapping, is that something the city should be doing? If so, what does that look like? How do we implement that, or how do we scale back if y'all think that's best? So shelter options. So a lot of y'all went through the whole process of a new shelter. What should it look like? Size, cost. We have that fundraising capital campaign. But also taking a fresh new look at some other options that are, out there and starting to become popular. So a regional shelter. We actually, some of staff went to visit a regional shelter up in the Dallas area, around Austin area. So seeing that and hearing how that works, I want to present that option to y'all to consider as a future option going down the road. And then partnerships with 501c3. So a lot of shelters have a Sugarland specific partner, like BART has a specific partner that helps them and works with their animals to get them adopted and out the door. So looking at that as an option to help us, again, keep capacity numbers down, help us adopt the animals, help us find their forever home. So we're going to be looking at a lot of different policies and procedures and programs. Some y'all may have already had discussions on in previous years, and some may be new. But kind of getting that new approach of right now, what and how should we proceeding going forward in regards to the animal shelter and just animal services in general.
Any questions about that?
I would just ask that when we get to the topic of TNR, if we have any data, we had made a decision to monitor the Greatwood and the Telfair groups of cats they were supposed to be our model or our test subjects, if you will. And our board had made decisions about contributing to food and neutering and spaying, even some of those to, I don't know, to give it the greatest possible chance of success, I think. And we didn't really get a lot of data back. And I'd be curious to know whether we have any outcomes on those two groups. Just when we get to that topic, it would be nice to see if we do have anything.
We'll have to look back around at those groups. My understanding is that Harvey did quite a number on those feral cat populations. So we'll have to look back around, and we do periodically have someone from this new territory who come and pick up just supplies that we have available for donations. Because, for example, if someone comes and donates an open bag of cat food, one, we want our animals to have a stable diet and not just, whatever food is available, but the bag is open. So those are the sorts of things that we put to the side that we have available for entities like the new territory, colony manager to come pick up. So we'll loop back around.
Any other questions or concerns? Okay. That all looks wonderful. About when will we be looking at the other shelter options? Because I think the work on the shelter. Oh, perfect. Thank you.
So as Nicole kind of alluded to, we have to meet at least 3 times a year. Just because we're going to be going through a thorough review of everything, we're just going to plan that we're going to meet every month until we get through the work. So these are the dates for the second Wednesday of each month. And I will I believe I already did put these dates on y'all's calendar. And if we need to modify, remove some, or there may be a month that we don't end up having, that's fine, but I want them to be on y'all's radar that we will meet, and we'll just take it step by step each meeting and slowly tick through the work. So it will be a lot of discussion, a lot of talking, like a lot of, if y'all have ideas on, certain topics, bring them to the meeting, because we're open to hearing and discussing anything that's out there right now.
Could you just give us a general overview of where we are in terms of the city and how they're operating with the options of the new shelter, or is that completely off the table, or where are we on that timeline?
Correct. So every year council prioritizes the capital improvement budget. And so the shelter is in that capital improvement plan. It is, I believe, 25 is where it stands now. It can fluctuate each year just based on the priorities, based on funding. And so right now that's where we stand, and that would be for design construction. So even if it stayed at 24, 25, you're still talking 2 or 3 years out from having a new shelter. So that's kind of why we're going to go through this process to figure out, okay, if we never get a shelter, like here are options that we can implement to keep our capacity numbers down, but still be a successful shelter. Even if it does come, here's things that we can do until it comes to, again, continue to help us be a success. So, but currently it's in 24, 25. I can get the exact year for the next meeting. My apologies, I meant to do that.
I'd like to propose that when we get to the procedure portion, that I guess in my mind, I kind of think of priority as animal health and well-being goes without saying that that's top priority. But, and then next, I I'm interested in focusing some attention to customer facing or public facing processes. Jenna and I had opportunity to interface with the public this past weekend. And I think there's lots of people who don't understand how to interact with us. So when we get to procedures, having some focus on those customer facing places, I think could lend us or gain us goodwill. And I'd be interested in spending some time on those when we get to procedures. And of course, you know, financial, I mean, I sit here representing all my neighbors, everybody in the community, and there's concern about money. So I don't want to say that, you know, that's not a factor, but I just kind of look at our procedures and prioritize and say those customer facing ones, I'd like us to get to earlier rather than later. So, because I think there's something to be gained from doing that.
Do
have
you
anything
say that you mean like social media or kind of our website and how it's set up?
Well,
Just so
I
that we
think,
know what sort of,
okay.
what you're.
So this specifically was that on the weekend, people don't know how to contact the animal shelter. So they call the shelter
The
for
issue
the,
you
yes.
emailed me. Yes.
They didn't know, and the homeowner was completely shocked when I told her that I had called the sergeant at the police department for him to decide or to say whether this was an emergency that he would send an animal control officer out for. She was shocked that, you know, I might be talking to the police about this thing that happened on her property. And so they don't understand, a lot of people do not understand that it's entirely just normal procedure to call the non-emergency number and say, I have a wildlife emergency. This was a wildlife emergency or an animal emergency, and let them make the determination whether it's worth sending somebody out on. You know, they just don't know. And so then once nothing happens, if nothing happens, then there's chatter on the social media about somebody not being available to help them. So I just think that there's some things like that where places where we interact with customers that I don't know if it's just advertising or, you know, somehow making the public, making the policy or procedure more, making people more aware of it, and our board included. You know, I think we should all understand if somebody, if we see something going on in social media, for instance, and a lot of us might, what do you say? And how do you, you know, we should know that you just advise somebody to call the non-emergency number. And
So I think
as our membership changes, we may not know that.
Definitely the component of that. I think in this particular case, the incident that you're talking about, there's also some internal discussions, some items that we need to sort out with our after hours call service. We're still working to identify where exactly the confusion lay in that scenario. But I think in this case, there's also some work that we need to do internally to make sure everyone is being provided the most accurate information.
Yeah, but I think you're right, because most people don't know who they're supposed to call. So it's as simple as like education on Nextdoor, social media, call 311. That's the easiest for any answer or any question. Call 311, and then they'll direct you to call. But yes, we would call the non-emergency line, and so we could put out that education, especially in the area that it happened. Nobody knew what to do, and I hate that. So yes, I agree. We need to be proactively educating on different.
And that seems a pretty simple thing to solve somehow. And I just think that there's things like that that wouldn't take a lot of work, that if we prioritize them to be earlier in our review or revision, that we reap the benefit of that while we work on the meatier things that are going to take longer.
Yes, that would engender a lot of goodwill.
Okay, well then, do I have a motion to adjourn the meeting? Is there a second? Second, thank you. This meeting is officially